Hey, this is Dr. Kyle with Spine and Wellness Go.
And what we want to talk about today is tension that comes across the tops of the shoulders and that upper back. All too often, people are going to notice that they start to get like muscle tensions. They might call them spasms. They call them their knots. Different things that are essentially coming across the tops of the shoulders, almost right on top of the scapula here. And so for us, when somebody's talking about being really, really tight across in through here, that lets us know that those muscles are tight. And ultimately what we want to figure out is why those muscles are tight. And so all too often, okay, that head is going to transition towards the front. And when that head comes forward and the shoulders round, what that's going to do is it's going to pull those muscles. And so if that's like that for a couple minutes, it's no big deal. But if this is your normal when we're sitting at a desk or we're looking down at our cell phone, okay, especially when people are looking at their cell phone, we're 2 to 3 hours a day on average looking at our cell phone and 8 to 10 hours a day looking at a screen. Okay, and so making sure that our posture when we're doing those different movements are perfect. So for her here, what we want to do is we want to make sure those shoulders are back, okay, and the head sits back up over the shoulders. That's going to take tension off of these muscles and keep those spasms across the top of the shoulder at a minimum. But if you are experiencing issues with spasms, tightness, trigger points, all those different things across the top where you just feel like your shoulders are constantly tight, okay, underlying conditions that we're going to look for is if we've lost that curve in the neck, where the head's starting to transition towards the front, putting a ton of pressure in through here. And so structurally within the office, we're going to take a set of pictures, we're going to take some x-rays to see exactly what the structure of the spine looks like, so that way on a correctional standpoint, we know exactly what we need to do as far as adjusting, therapies, at-home care, in order to correct this for the long term. It's kind of similar to braces. If we want to straighten our teeth out and make them look pretty, okay, it's going to take time for an orthodontist to allow that to happen. It could be years for that to be done. And so same thing for the spine. What we want to do is we want to look structurally, how do we get the spine back to its normal? So that way we can ultimately get the weight of the spine where it needs to be and stop any type of degeneration or arthritic problems that are happening. And so we would put together a plan in order to correct that. Okay, it's not going to take 2 or 3 years, but it does take a little bit of time in order to correct the structure of the spine to get it back to where it would be considered normal and get the weight-bearing portion of the spine where it needs to be, and ultimately pressure off the nervous system. And some of the things that we see as far as when there is pressure on the nervous system would be that tension across the top here. We could have numbness and tingling down into our hands. The nerves at those levels as well go to your thyroid, they go to your heart, they go to your lungs. And so making sure that there's nothing putting pressure on those nerves, so that way the communication out to where those nerves are going is at 100%, whether it be your muscles, whether it be your heart, your lungs, your thyroid. Okay? And so in order to evaluate that, there's a couple different ways that we can accomplish that. But the first thing I'll have Dr. Bailey do here is go ahead and lay on her stomach. And all too often, when we have that head pulling towards the front, we get a lot of tension up and through here. One thing that I always like to check to see is if we have a first rib issue. Okay, and your first rib actually sits right up at the very top. And so when you come in there and we apply some pressure where that first rib issue, or the first rib is at, okay, it's going to be pretty tender if we're having rib issues up at the top. And so we'll come up to the front, we'll feel in through there, and a lot of times she'll be able to tell me if it's tender or not in those areas, which is a pretty good indication that that bone could be out of alignment, which ultimately would correspond to the CT junction, which is your cervical thoracic junction. Now another way that I test that specifically is I actually have her put her hand on the back of her head, and we're going to bring her elbow up. And what I'm looking for is I want her to be able to hold my resistance when I push down. And so go ahead and hold that for me. And you'll notice that she can hold that pressure. Now, if there is an issue with her rib on that right side, essentially what happens is she just goes weak and that arm comes down. Okay? So then we'll go ahead and check the other side just to make sure that one's free and clear. So go ahead and put your arm up there. We're going to hold that elbow up. I'm going to push that down, and we're looking for any type of weakness in there. So for her, we're not having any first rib issues, which is great. Okay? Now, next thing the step would be is once we've cleared that zone out, what we want to look to see is if there's any misalignments in our upper thoracic spine, essentially right up between those shoulder blades. Okay, a couple different ways that we can test it. Essentially, if the spine is subluxated, those bones are not going to move. Okay, and so what I like to do is just apply some general pressure on the backside. So I'll work my way up, feeling for any restriction. So when I push in here, those bones should give. Now, one thing she would notice is if those bones are out of alignment, there's going to be tenderness right on the spinous process, which is the bones that we actually feel when we touch our spine. And so as we work our way through that spine, we're looking for any of those restrictions in those zones, okay? And for her, we're going to notice right up and through here that she's got some tenderness in there. Would you agree? Okay. And so in order to adjust that, it depends on the region. Okay, for me, if it's up here, I'm going to adjust up at the top. And so if we look here for her, hers is coming on that left side. So I would go over to the other side. We'd come right in through here, make that contact, take a nice deep breath in, all the way out. And we'd adjust that. Okay. Once we adjust it, I always come back to confirm that the bone is actually moved. We're going to come back in through here, and we're going to feel that that rotation and that tenderness for her has gone away. Okay. Same thing as we come down through the spine here. Okay. Want to make sure that all these bones are free and clear. Okay. Especially kind of in this middle zone. One thing we'll notice with patients, and they may or may not even tell us, but they could have acid reflux or stomach issues. And the reason why we're talking this zone is because that's where the nerves are going out to power. So they're going to power the stomach. And so by adjusting in through here, it's going to allow the communication of those nerves to their end organs to be correct. And a lot of times, a lot of the issues the body is presenting with symptom-wise are going to start to resolve once the communication from the nerves to the end organ is where it needs to be. And so in order to adjust that there, I'd have her take a nice deep breath in and let it all the way out. And just allow a little bit of pressure in through here, and we're going to feel that bone.